Tuesdays, which was Transformation Tuesdays. We're going to be focusing on advocacy for social change in nursing homes. And we already have our first panelist, who's Catherine Pettis, the policy director for International Association for Hospice and Palliative Care. And Sarah, thank you so much for remembering to do the recording. So I just wanted to say thank you for all the panelists, and looking forward to which will no doubt be a lively discussion. Evie, would you please take it away?
Absolutely. Thank you so much for that beautiful introduction, Jack. I just want to apologize that I can't be on the Zoom page because some technical issues that have arisen. So I'm here by phone. I absolutely want to welcome you to our forum on the Live Oak Project. This coalition formed this year really as a result of what's been going on and what's been discussed around in nursing homes, what was exposed this year because of the pandemic and the resulting deaths. And what was exposed are things that we've known about for years and years and years, and we know that it can be different. The members of this group have been working not only passionately, but compassionately for 20 to 50 years to change the culture of long-term care. And although there have been positive changes because of the culture change movement, which includes the Eden Alternative, which was started by Dr. Bill and his wife, Jude Thomas, and the Pioneer Network, plus many other groups. But the change hasn't occurred in the majority of long-term care services and long-term care homes. But this panel of experts will enlighten some of our major concerns and why we need change now. I'm going to introduce the speakers by name, and I will ask them each a question. And please note, write in any of your questions into the chat box, and at the end, we will have time for questions. We've made sure of that. So the first member to speak is Rosemary Fagan. And Rosemary, you may want to add a little bit more about your background, but the question is, how did we get here? And what did the bright lights along the way tell us about the future?
Hey, thank you, Evie. Thank you, everybody, and welcome, everybody. I'm Rosemary Fagan, and I moved to Georgia about 5 years ago from Rochester, New York, where I lived all my life. And after a career as a teacher and as a stay-at-home mom, in my second half of life, I re-entered the workforce as an ombudsman, as an advocate for nursing home residents. And my first day as an ombudsman in a nursing home was just appalling to me. I saw CNAs trying to feed 5 people at a time. I heard screams from faraway places, stressed out staff. And the client that I went to see, well, he begged us to get him out of there because it wasn't a home. Because, you know, in the traditional institutional nursing homes, the staff write in the chart, Mrs. Smith is adjusting well to the ABC nursing home, instead of the facility adjusting to Mrs. Smith, knowing who she is and what does she need to thrive and to be at home. So that day, as I left that nursing home, I passed by residents with their arms outstretched, help me, help me, help me. And I turned to my boss and said, wow, if there's a hell, I was just in it. How did these places get this way? Why are they this way? And so I started doing some homework, and I learned about the early history of elder care, but a turning point in how elders are cared for in America came in 1965, when Medicaid and Medicare began providing stable funding to nursing homes that met federal standards. The fatal flaw, unfortunately, is that they were modeled to operate like hospitals. And almost immediately, there were scandals of people being neglected, abused, drugged, restrained, no activities. There were even cases of people being fed cat food and dog food. These scandals tarnished the reputation of nursing homes that's lasted to this day. And that's the impetus to tighten regulations and for advocacy to improve care. So all of those scandals culminated in the passage of the Nursing Home Reform Law of 1987. And that establishes quality standards, it preserves residents' rights, and emphasizes quality of life and care. The law mandates eliminating chemical and physical restraints, providing individualized care for the body, mind, and spirit, and helping residents reach their highest practicable level in a home-like setting. So I ask, why isn't this law enforced? Beginning in the mid-70s, visionary pioneers around the country knew that there was a better way. My fellow panelists, Jeff and Barry and Kathy, are among the earliest pioneers with approaches like regenerative community and individualized care, restoring control to the resident, eliminating the plagues of loneliness, helplessness, and boredom. And the household model transforms that institutional hospital setting into small households, 10 to 20 people living together and creating a genuine home. So those are just some of the innovative approaches. And then in 1997, these nursing home pioneers met in Rochester, New York with other stakeholders, and we launched the Culture Change Movement. Now that's the common name given to the national movement to reimagine, redesign, and transform long-term care services and supports that are based on person-centered values and principles. Our mantra is person first. And we also formed the Pioneer Network as an umbrella organization for the Culture Change Movement, and I became their founding executive director. Now, the Centers for Medicaid and Medicare Services, we call it CMS, provides the oversight to nursing homes, and they endorse culture change. They release the Artifacts of Culture Change, which is a self-study tool for nursing homes to assess their baseline and to progress toward culture change. They also held symposiums on the environmental requirements and another one on food and dining requirements. And those led to the first revision of the federal nursing home regulations that integrate person-centered care and quality of life. What's been accomplished since 1997? We have the nursing home reform law, we have regulations and interpretive guidelines, we have national partnerships, and we have exemplars all around the country demonstrating that it can be different. We have a business case that shows that it's financially viable. We have the Artifacts of Culture Change and case studies and evidence-based research. We have a website and how-to materials, national speakers and consultants, national conferences, state coalitions. At one point, we had 36 state coalitions for culture change. Yet, despite all of these achievements, change has been incremental. With so much evidence, why is this taking so long? Where is the public outrage? COVID-19 exposed the United States long-term care system is deeply flawed and underfunded among the many issues so many of us had known about for decades, such as workforce issues, lack of transparency, enforcement, and infrastructure of outdated old buildings. These complex problems cannot be fixed in a piecemeal or simplistic fashion, and especially not with more regulation. The industry is already the second highest regulated industry. Now exposed, the issues of our failed long-term care system will not go away. Almost daily, there's mention in the media, and there are articles published. Barry, Jeff, and I, in collaboration with the Pioneer Network, have written a call to action paper which defines the complexity of the problem and it offers integrated solutions. The paper calls for us to reimagine, redesign every aspect of the system in a holistic way so that each person thrives. And you can obtain a copy of the call to action paper by emailing me, and the information's in the chat box how to do that. We must seize the moment. The time is now for us to ask America, what are our values? We must expand our vision and stand on the shoulders of those before us and their achievements to ensure that the movement continues, that it grows, and that it expands. So you may ask, well, what can I do? Well, first, educate yourself and become an advocate. Help to increase public awareness. Know that everyone can make a difference. What's your sphere of influence? Join the movement. Make a difference to create what we want for ourselves and what we want for our loved ones. Margaret Mead's quote is, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has."
Really good. Rosemary, thank you so much. Is Evie still on the call?
I don't know. I don't think so.
Yes.
Oh.
Okay, I was muted. Someone muted me, so I figured out how to unmute. Can you hear me now?
Yes.
Okay, beautiful. Thank you, Rosemary. That was powerful. Really well done. And now I want to introduce our second member, Jeff Jarebker, who I have had the privilege to know and work with for many, many years. Jeff, can you tell us just a little bit more about your background? And then the question I want to ask you is, could you please talk about the importance of architecture and the environment?
Oh, no. Did we lose him?
Jeff, you're muted.
Oh,
Thank you. Can you hear me now?
Yes.
Hi. Well, it's great to be here, and thank you for that introduction, Evie. So I'll just briefly talk about my background, then I want to get into the future. So Pinion Management, which was a company I formed in 1979, when we put in what we call the first psychosocial model of care in Colorado in nursing home care, which is a holistic approach. We expanded on that and we took over many of these old buildings and put in holistic, what we call psychosocial models of care. We had very good outcomes. And then when when nursing home reform in 1987 really took effect in 1989 and 1990, it wasn't, while a lot of people were enamored by it, I think there was a false sense of hope because there were two fatal flaws to the Nursing Home Reform Act. One was it didn't mandate reimbursement to align with highest practical level. And most states didn't reimburse adequately. Second major flaw was the architecture. Rosemary, and architecture and reimbursement are not seen an odd couple, but they are intricately linked together. When nursing homes were built, as Rosemary suggested, on a hospital model in the mid-60s and mid-70s, long corridors, semi-private, sometimes even more than semi-private, triple occupied rooms, et cetera. Medicaid reimbursement reimbursed nursing homes at the beginning of that time. The only way you made a profit was to have high occupancy, which meant overcrowdedness. It was designed to be overcrowded, and maximize or minimize your cost of care. Now we have evolved since then, but basically there's still a ton of nursing homes out there that were built in the 60s and 70s. A lot of them have been remodeled to some extent. There's been improvements made, but we still have the fundamental thing that even though there's been a lot of psychosocial, there's been a lot of holistic, there's been a lot of reform in nursing homes, and they did make a difference. When the pandemic hit, it was like dominoes falling. It was the great equalizer in the sense that even well-managed nursing homes did not do well in the pandemic. And because we didn't solve the fundamental problem of overcrowdedness and reimbursement that didn't provide enough incentives to change the landscape of long-term care. So what I want to talk about is what are some of the practical things that we could do going forward to not only ameliorate the situation, but that we could say in the short term and in the long term, like for example, maybe in 10 years from now, the typical nursing home won't be these nursing homes built in the mid-60s and mid-70s. Maybe they will look completely different. Maybe they would have more room. Maybe everybody would have private rooms and private bathrooms. maybe to be more common area for community gatherings, et cetera. There's so much, maybe to be better air ventilation, access to outdoor space, better lighting within the nursing home. So all of this actually was left out of the Nursing Home Reform Act. And somehow that wasn't part of the highest practical level. And yet, you know, one of the most fundamental things is to be safe during an epidemic or a pandemic. And obviously the whole system crashed. So my thing is, I think there needs to be a galvanizing movement as part of this call to action. I'm just talking about one aspect of it. And that is reimbursement. Imagine reimbursement that provides incentives, and there are a number of ways Medicaid can provide incentives, that one encourages these old buildings to kind of reduce their license beds, have more space, convert to private rooms, and improve their ventilation system. Now let's take two aspects that could provide incentives. One is the reimbursement itself. Most Medicaid systems and states have property components. So imagine on the state level that the property component for Medicaid reimburses at a higher amount for that amount for nursing homes that are investing money in doing just that. Now imagine if the federal government was part of this effort and said, you know what, the federal participation money that we give the states, for that purpose, for the purpose of converting to those private rooms and bathrooms, we'll increase the federal match to help states afford it. Then imagine like even tax policy that could say, well, we'll allow accelerated depreciation or other tax incentives. So all of this would provide for-profit and not-for-profit providers incentives for doing homes into a more healthy environment. So that's one aspect. The other aspect I would like to talk about are new models. It was alluded to in Rosemarie's opening statement. New models have started to develop. They're still on the margins, but they started to develop. And if there's one thing that it seemed that the pandemic showed us, was that whether it's small household or households or however you want to label it, people that had, or residents in buildings that have private rooms, private bathrooms, and generally more square footage, did better during the pandemic. Now, there's more studies that need to come out, but preliminary studies show that as much as 75% less per patient day on the new models that have private rooms, et cetera, et cetera. Whether that's accurate or not will be determined over the next few years, because I think there's going to be a lot of money put into these research. But it makes logical sense when you think about it. It's easier to control infectious diseases when there's not an overcrowded situation, when you have a private bathroom. It's not that illogical to see why they were much more successful. I also think there's great possibility for a more holistic care in these small model private rooms, or whether they're greenhouses or whether they're other ones. There's a number of new models that unfortunately are more in the province of Medicare or private pay, because most of them are too expensive for Medicaid recipients to go into. I'm involved in 2 greenhouse projects in Colorado. Both of them are full, and both of them have quotas on the amount of Medicaid they will allow in, and they're nonprofits. And so that's what keeps them on the margin, is because Medicaid recipients don't have the ability to get into these particular new models. So I have a couple of proposals for that. One is, most states have a form of certificate of need or moratorium on Medicaid beds for nursing homes. I suggest that that moratorium be suspended for new models. They should allow these new models to come into the system. That would not only allow financial capital to pour into those new models, it would also provide incentives for these old buildings to really modernize their homes, because now they're going to have more competition. And I think that with more money coming in to that particular aspect of long-term care, we're going to see a lot of innovation. We are already seeing some innovation. There's been more articles written on the problems of nursing home in this past year than in the whole history of my career, which has been 40 years. And obviously it's because of the dramatic failure, but people are kind of groping around as to what are the next steps. So I just sort of presented a couple of my ideas for the next steps. They're not particularly complete, but I think that we have to now not make the same mistake we did with Nursing Home Reform Act of 1987. We have to take into account the architecture, the reimbursement, and the environment as much as holistic programming and other things. So it kind of succinctly summarizes my presentation.
Thank you so much, Jeff. That was excellent. It's always a pleasure to listen to Jeff and learn about his expertise in this area. And our next presenter is Kathy Uncino. And Kathy, if you can tell us a little bit more about your background. And the question I will ask of you is, could you please talk about the importance of the human environment that enhances life so that people who live and work in nursing homes can thrive?
Thanks so much, Evie. I'm a psychotherapist and have been involved for many years in nursing home transformation. And it's interesting because people come to a psychotherapist when they feel stuck in life and they want to grow and they want to expand their opportunities to live more fully and a more satisfying life. And so when we come to nursing homes that are stuck, it's a very complementary kind of thing where we want to help them grow. One of the things that I think has been missing, I agree with Jeff when he talked about OBRA not having reimbursement attached, really limiting. But I think one of the limitations has been also that there needs to be more education, which is why I really am pleased that Jack has embarked on this for Grey Panthers, because I think that some facilities just don't know how do we improve, let's say, the human environment. And so I suggest that nursing homes consider starting with what will succeed most quickly, which is with residents themselves and the staff closest to them, that team, as the primary change agents in nursing home transformation. What we want to transform from and to, from a sedentary, passive kind of institutional life with anonymity for people, into communities where every resident is known as a person and knows one another, not like a dysfunctional family where they don't even know the people with whom they're living. And the staff aren't given the most basic tool, which is to know who each resident is as a person. And yet they're relating in the most intimate ways to people that remain unknown. So for instance, a nursing home showed me that the staff were given index cards about every single person, and it said the same thing: incontinent, combative, demented. That's all it said. It didn't say so-and-so was a much beloved English teacher. So-and-so won the silver medal in Berlin in 1936. So-and-so had the tailor shop. This person, nothing with whom the staff can relate. So when we talk about the human environment, the way of changing it, I believe, is by modeling it ourselves. And I'll give you examples of that. So that humanistic behavior, humanistic thought, humanism becomes reflexive for everybody who lives and works there. So I'll give you an example. On the 4th of July in 1995, I visited someone in a nursing home that I cared about very much. And yet it wasn't the 4th of July on that floor. Residents were lined up against the wall in their wheelchairs. 2 men were cursing at each other. Another man was throwing chairs. Staff, wonderful staff, were working as hard as they could work. And no matter how dedicated they were, they couldn't get the result that they and everyone wants because the institutional culture won't permit it. So I got permission to run the first group with those residents. 70% of them had some form of cognitive loss. Others had severe physical illnesses with which they were coping. And to model, I'll just give you 1 or 2 examples in the interest of the short time we have. Just as I was about to begin the group, a woman called out banging on the arms of her wheelchair. Why? 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 I thanked her for asking why. Don't we all ask why? And she's really begun our group in the best possible way. Maybe we need to quest for meaning together. So she sat up tall in the chair and smiled, looked up very proud. And then a man said, and I thanked him for reminding us that in our group, every person matters, every voice counts. Pretty soon the residents were looking at each other and smiling and looking relaxed. And so we started singing. And you may say singing. Singing is a wonderful way to help build community. It strengthens the voices of residents and immediately gives them opportunities to go from being sedentary to being active and expressing themselves. Music with songs that were about every aspect of human life. Inspiring songs, funny songs, patriotic songs, Broadway shows, everything you can think of. And one of the things we discovered, which isn't known, is one of the many strengths that people with Alzheimer's have, is an incredible memory for music. One of the other strengths is a strong capacity to relate to feelings, stronger than the average public. But the other strength is this remarkable memory of melody. And so my hope is that as we introduce this in nursing homes all over the country, that we can do research to show it's not a cure for Alzheimer's by any means, but how to help strengthen people who are dealing with cognitive loss and other losses to have more fulfilling lives, more enjoyable lives. In the interest of, and I want to say that we went from singing to poetry, to talking about current events, to reminiscing about holidays past, about important events in their lives. One of the most beautiful moments came when I asked the following question. Would you each think about your earliest childhood memories? And what was your earliest memory of something beautiful, very beautiful, little children? And their responses were extraordinary. And I hope in the Q&A, if we have time, that you'll ask about those. But the nursing home residents themselves began to reach out to one another to enjoy each other's company. And the staff commented immediately, Kathy, since that first 4th of July party, the whole floor has changed. The nursing home residents seem happier, easier to care for, vibrant, talking to us. Can you do this again? So I did it every week for several months pro bono. And then the staff said, can you meet with us? And fortunately, administration gave us permission to meet on a weekly basis. And I want to talk about this for the staff. In the interest of time, I urge anyone who's interested to look up problem-based learning on the internet, PBL, because that's essentially what I used in approaching the staff in every nursing home that I subsequently worked in, asking them who's the resident about whom you're most concerned. And like a Greek chorus, they always named the same person. What we want to do with PBL is for the staff themselves to identify what the problems are, what's wrong, to solve them, to build teams, to get to know each resident as a person. We don't have time for me to tell you all those stories, but what's contagious about this transformation is that the staff got it immediately. Morale soared. This was a unit that had more union grievances in one unit than the units of the 800 plus bed facility combined, all of them combined. And yet once we started PBL with the staff, where they themselves became agents of change, their morale soared, their care of residents was extraordinary because they got to know every single resident as a person and to solve the problems themselves. So I really, in the interest of time, have to end it there. But I ask, how can we not do this? It's not hard to do. It's not rocket science, it's just common sense. And if we have more educational programs such as this one, Jack, it would help nursing homes see what's possible for them. Of course, we want private rooms at baths, but the human environment must also be transformed. And I would say if we're going to do architecture to encourage people to think of models that have about 20 to 25 residents so that the reimbursement gives you permission to hire adequate staff so you can have meaningful activities. If you go too small in the model, then you won't be able to hire adequate staff. And then you're stuck with a built environment that you can't enlarge if you then discover, oh my gosh, we went too small on this. So I hope that the human environment gets the attention that it very much deserves. And thank you so much, Gray Panthers, for doing this. By the way, the time is now, not only for this generation, but for future generations, because we have an unprecedented opportunity now with the tragedy of COVID, that everybody wants to improve things, and that includes all the stakeholders, residents, families, advocates, and providers are looking for help. And we need to do this together, not adversarially. Thank you.
God bless you.
Thank you so much, Kathy. That was beautiful and such vital information, so important. Thank you, thank you. And last but absolutely not least, is I want to introduce Barry Buckins. Barry has been doing this for a very, very long time. Barry, can you tell us just a little bit more about your background? And the question I have for you is, how do you see the whole system as an integrated learning-based community as the necessary ingredient in transformation?
Thanks, Evie. Jack, thank you so much for organizing this, and all honor to the Gray Panthers. I was an old friend of Maggie Coons back in the old days. I'm in bed right now. I don't usually attend Zoom meetings in bed, but I'm battling the crud, and I've been, so I'm bed bound, but I didn't want to miss this meeting today in any way. And so I need to come from my lack of clarity this morning, and my desire to be present with y'all. You know, it's all one whole. You know, at the center of the whole is the resident. And if we were looking at it as concentric circles, in the next circle comes those direct caregivers and family members and those closest to the resident. Next circle comes the professional staff. Next circle comes administrative staff. And then in the circle surrounding that come all those systems and agencies that impact what goes on. And it's a very interesting thing. You know, we've been engaged for many, many years, since 1977, when we started the first regenerative community in a nursing home. And our whole idea was that we needed to focus on well-being. You know, the latest guidelines from OBRA, for example, from CMS, have nothing to say about how you improve resident well-being. It's all about how you improve clinical. But clinical and resident well-being are intricately attached. A person in their room who doesn't receive respect, choice, participation tends to be less well, depressed, saddened, and that impacts their physical health. You see, everything impacts everything else. And so when looking at this whole map, I like to think of it as a universe of elder services and support. That whole universe is interactive and interconnected. So, for example, one of the things that everybody's talking about post-COVID is, oh my God, all these people perished in nursing homes. What we need to do is to increase regulation. Well, the reality is that it just tightens the screw and it doesn't change anything, because we've had years and years and years and years of a punitive regulatory system that doesn't look at the whole, and that does not help to improve care in a way that's supportive and educational. So you have everything is done to the survey. You know, one of the big complaints about education is that everything is done today to the test. Well, in nursing homes, everything is done to the survey. It's not done for resident care. So a resident surveyor comes in, they come in, and there are many good ones, but too often they come in with an attitude of the police officer, not the community police officer, not community policing, but with someone investigating a crime. And they come in with an attitude, the staff gets thrown off kilter, the residents get thrown off kilter, and everything affects everything else. So one of the things that also affects everything, of course, is reimbursement. And another thing is that the way the system operates is that there's no sense of a holistic integrated system at the top. And because of that, everything is broken down into silos. One of the worst aspects of what goes on in any institutional life is everything is siloed. So you have staff who are nursing assistants, and that's a silo. You have staff who are licensed nurses, and that's a silo. And each of these silos don't talk to each other. And so they do talk to each other, but they're also involved in what it is they're doing, that there's no attention paid to the whole. And then reimbursement is a silo. Jeff mentioned earlier how tax benefits for people who invest in new nursing home, and I don't even think we should call them nursing homes anymore. We need a new name for them. They're not nursing homes. The name we like is a regenerative community, a place where people come to be well, where people come to have their wellness increased, where people come to be known and know each other, where people come to have dignity, where people have meaning in life and have a future. Because one of the worst aspects of what goes on in long-term care is that people are not seen in terms of who they are as a person, and they don't know one another. And because they don't know one another, there's no sense within the environment that they have a future. And when you have no future, when they don't know who you are and where you've come from, and you're not connected to any possibility for future, you're in a limbo, a space-time limbo. And all of this is part of a system that doesn't see, that's not person-centered at the center, that doesn't respond to the person, and is not seen as an integrated whole in which what happens in one part of the system impacts everything else. So perhaps the first thing that has to happen is, pardon me, please. Perhaps the first thing that has to happen, perhaps the first thing that has to happen is that we have to see everything is connected and every person matters, whether it's the CNA who's under-respected, underpaid, whose voice is not heard, whose knowledge is not respected, to the person who's a resident, to the licensed nurse whose whole job is mostly defined by their ability to do paperwork piled on paperwork piled on paperwork. Paperwork has very little to do with outcomes. But the people who are on top don't talk to the people at the bottom, don't look at what goes on within the whole system. And so what the Live Oak Project is really about is integrating everything into one learning-based system in which we're all learning as we go. You know, there's very little that's being done in research and development in long-term care and the possibility for what can come out of it. It's like the only major industry in the United States, and I use the word industry advisedly because it's not an industry, it's a way of being with people and treating people. It's the only major industry in the United States that has virtually no budget for research and development. And so what we want to do with the Live Oak Project is really create the portals for research and development, for learning to go on, involving people on all levels, learning together. Because as my teacher, Reb Zalman, who founded the the conscious aging work says, the only way to get it together is together. And I thank you so much, Jack and the Great Panthers, for affording this opportunity, and Evie for the work you've been doing to help us build that national coalition that will help us get it together. Thank you all.
Thank you so much, Barry. So powerful, and we are all sending you healing thoughts so you get better very quickly. Just before we go into questions, and to receive your questions, just a little bit about the LIGO project. Right now, it includes about 30 leaders and experts in the field of culture change and long-term care. The call to action paper that's been mentioned was written by Barry Barkin, Rosemary Fagan, and Jeff Jaredker, and it's the beacon for planning for development and learning. Our coalition began by looking at our mission and guiding principles that we believe needs to govern the whole system. And right now, we're at a point where we are moving on to an actual work plan to build a national movement for transformation. We welcome support in many arenas to grow this movement. And we need to be strong, and we can only be strong when we come together. And we need to influence sustainable change in long-term services and supports throughout the nation. Please note, Rosemary did put the email address so that you can get the call to action paper, and we really urge you to read it. And if you want to get involved with us, please use that same email and let us know of your interest, and we will reach out to you. And now we will welcome your questions. And I thank the panel. You were just stellar, as I knew you would be. So questions from the audience. And of course, I can't see anyone because I'm on the phone. So you will have to manage her, Jack, or anyone else.
I'll take care of reading questions. So who has a question? I'm going to call on people.
There are questions in the chat,
There are?
Jack. Yeah.
Let me see. Oh,
Yeah, I'd be happy to read the one that I see from Carrie.
yeah.
It says, as I agree with all of you, it seems there is very little family involvement as you speak. Is there a reason why?
And whoever wants to tackle this question, somebody will tackle it, but I can assure you families are included. But who would like to tackle it more succinctly?
Kathy.
You know, when we had the meetings with residents, the community meetings with residents, family members came and became very active. And the social worker at that time, a wonderful social worker, Sandy Myers, who's now an ombudsperson in Westchester, really strengthened the group of families on the floor, and they were quite active and contributory. She even started a newsletter on the floor, and family members participated, interviewing staff. Staff were highlighted in each issue, residents were highlighted in each issue, family members. So it formed a community of families, residents, and staff. And that's really, and of course, Barry talks about the regenerative community. Our work was intuitive, his was conceptually based. It's about so that all parties can grow together. So families were very central in that community, form a beloved community on that floor. Thanks for the
Barry,
question.
I'm sorry. Barry, can you make a comment with regard to families?
You know, one of the things that families experience so terribly in nursing homes is that they don't really know how to interact with the people, with their family members. They feel, I'm sorry, I'm
Okay.
having,
So yes, they don't
let me
know how to.
just,
I can jump in here a little bit if you want me to, Jack. Am I on mute? What am I? Okay. What are we doing?
Just families.
I know. Do you want me to talk or Barry? are
Yes,
you-
yes,
Yeah,
yes.
let me just
Well-
finish saying, Rosemary,
sorry.
let me just finish saying what I'm saying. You know, Kathy spoke about community meetings. The heart of the regenerative community is the daily community meeting as well. And one of the things that occurred is that family members became active participants in the community meetings. And it gave them a way of relating to their family members that was never known before. And because we had a home that actively encouraged family participation in all aspects of the home. And indeed, we sought to feed family members when they came for lunch and to do all kinds of things like that. A number of family members would say, you know, I've always had a troubled relationship with my mother or my father, and it's better now than it's ever been in all the time we've been together. The whole idea is that you have to deinstitutionalize and make it a person-centered environment, a community. And then family will flourish. Families are not another silo.
Right.
They're part of the whole.
Oh, can I interrupt here, Jack?
Yeah,
So where I agree with 100% what you're saying, as you're moving forward, especially right now when families are more upset than they've ever been, probably, at least that would be my take from the hundreds that I deal with, wouldn't kind of highlighting, trying to involve families right now while they're still fired up, wouldn't, I would think that would help your movement of really trying to focus, add some focus to what can the family do to help with this movement? Because people are more upset right now than they've ever been. And it's like Jack's in the media, it's in the media every day. So why you have people's attention, it seems like it's the most opportune time to take advantage of that.
you're really right. Take advantage of
And if I could jump in there, Jack, if I can jump in, it's Evie. In the culture change movement, one of the things that we talk about is that everybody is part of the care partner team. And the care partner team is the elder, it's their family, and it's the staff who work in long-term care. And everybody is a team. And that's something that we emphasize on a regular basis when we're teaching, when we're consulting, and when we're helping people to advance the cause of quality of life for everybody.
I'd like to just chime in with something. When I lived in Rochester, New York, I was associated with Lifespan of Greater Rochester, which is a not-for-profit agency that provides services for older adults. And that's where the Ombudsman program is. Through the Ombudsman program, I'm getting some background noise.
Just go on, just continue to talk.
We did a lot of education to the public about how to be an effective advocate. A lot of family members do not know about the culture change movement. A lot of family members do not know how to advocate for culture change and what residents' rights are and how to advocate for that. So public awareness and public education and consumer education is an integral part of this.
Yep.
For families being involved, if they know what their rights are, if they know it can be different, if they know that there has a right to choice and quality of life and all of these things, they will become more effective advocates. But a lot of people don't even know that that it can be different and how to advocate for it. In Rochester, we put together a pamphlet. It was the SMART guide for how to choose a nursing home. And I'm sure we can make that available. But every community should have that and widely distribute it. So public education, we used to go out, give talks to churches, family councils, anywhere. But you're right, Carrie. I think that family members can advocate when they have the power of education.
Let me also kind of put Carrie in perspective. Carrie's situation, she has been an incredibly dogged advocate for against social isolation and the role of families in long-term care facilities. And she's the one of the founders of the Essential Caregivers network throughout the country. And currently, she's been a part of federal legislation that's about the role of caregivers, meaning family members, during periods of crisis. So she's looking at this and making huge inroads on the issues of social isolation and families with regard to residents of long-term care facilities. So
So
she's
let me add,
from that
to Jack.
perspective. Yeah,
So Jack, also, I have a 33-year-old son that is in long-term
Yes.
care. So he is in a, intermediate care facility for adults with developmental disabilities. Our building, though, is actually an ICF on one side and skilled nursing on the other. So I have the experience of seeing what it's doing in both aspects. And, I represent over 900 families in Illinois at this point. So the family aspect of this, where I agree, this is education. People don't understand they have the right to speak up. And, I've built a whole YouTube system on showing people how to ask facilities for what you need, because nobody knew what to do. So education would be the greatest benefit to where this could start.
that is awesome. What I'd like to do is I'd also like to ask for other people who have questions or comments about today's presentations, because we're going to be all of us are going to be working together very soon. And if you don't have a question, I'm going to call on you. So who has a question?
Ed Cook, I have a question. Rightly or wrongly, I've been fascinated by the complete flop of the ombudsman nationwide. And we talk about education. If anybody needs to be educated, it seems to be that group. And they're the only foot that we have in the door on a constant basis. Does any of the group have some ways to resuscitate that program and enliven it?
Rosemary?
I'm sorry, I'm distracted. I didn't hear the question.
Enlivening the ombudsman program.
How to enliven it?
Yes, make it a little bit more effective and give it a little bit more teeth.
Well, Consumer Voice has the Ombudsman Resource Center. That's the national. And I think that that's another area that we used to do a lot of education. We used to go to Consumer Voice meetings and talk to the state ombudsman, because we see the ombudsman program as a natural vehicle for education and advocacy for culture change, and a wonderful link to family members, because they work with family members. So the ombudsman program is key. And I think that I don't know who the director is anymore at HHS. I don't know who. I know it used to be Becky Kurtz back in my day. But I think you have to go to a high level, and we have to do education so that it trickles down to, this is part of the ombudsman program, is to know about culture change and how to advocate and teach families how to advocate for the rights that family members are entitled. I have to tell you, we've been at this for 40, 50 years. There is still so much work to be done. And I can almost hear your impatience, and I'm more impatient than all of you together. We want to see this done, and it's just going to take all of us to. It's like eating an elephant, a bite at a time, and we all have to find out where our sphere of influence is, and to get involved and make this happen. It's not going to happen unless the government knows that we all know it can be different, and we've proven it can be different, and we just demand it. I know that sounds simplistic, but I say, where is the outrage? How could we have known all of this for so long? And then people say, well, you need to do research. So we did the research. Well, you need a business case. So we did the business case. I feel like we're just appeasing all of this. And it's like you know, I'm
That's
at the
true.
point where it's
That's
like,
true.
this should just be, and
Yeah.
make it
I'm going to,
Hello,
Barry?
this is Wendy Kelly. You talked about ombudsman. I'm one. I am one, and I work at the a nursing home in the Bronx. And in defense of ombudsmen who are still out there, and we are still being trained on a monthly basis for the most part, I would just like to say involving the family. In one of my cases, I had a resident at a nursing home who experienced some difficulty with the staff, and she had a valid complaint. I contacted the family. The family did not want to be involved in their mother's life. They said they were too busy. They had things to do. They had to go to work. I had to call the daughter and I asked her, please make contact with your mother. The families must come in and be proactive with their members that are in the nursing homes. Once those staff members see the family involvement, there's better treatment of the residents in those nursing homes. If they don't see anybody coming to visit them, they don't see any participation on the family or friends and the faith-based community, they need to be involved also. So when you say family, some family members have dropped off their loved ones and left it to the nursing home to take care of them. I'm sorry to say, but that's what they do.
Well, you're right, Wendy. And I always like to correct people because we talk about, oh, and their loved ones and they're advocating for their loved. Not everybody loves their family members. So that you're making a good point.
If there aren't any other, Barry, you want to make a comment?
Yeah, I think that there are wonderful ombudsmen all around the country. And there are some who are disastrously inept and are just bureaucrats. And I think that what we need to be able to do, is identify who the best ones are, what the best practices for ombudsmen are, and put pressure on folks to get rid of the ones who are inadequate and unresponsive, because it's really a waste of taxpayer dollars just to have somebody pushing paper. You need to have ombudsmen involved, not as surrogates for the state in looking at complaints, but as people who are trained in the skills of bringing people together, of educating, of helping people to hear one another, and when necessary, pressing the levers of change that exist to force the homes to make the change that needs to go on.
Thank you. Carolyn, you had wanted to say something, and that will be the last question. Unmute yourself.
I should know this by now, right? I agree with everybody. We all have an altruistic attitude towards what we feel that we should do, what should be done. But from my experience, my personal experience, I have been in nursing homes, and when I see all of the seniors lined up with their heads down in wheelchairs and nobody paying attention to them, they're drugged, and that's to keep them quiet, probably because of some of the reasons that we're talking about. Their fear, their anxiety, their wanting to be home. Okay, I feel that there should be, getting to reimbursements, there should be some kind of a check on, are these nursing homes being paid for because of how many pills they're administering to these poor people who are there. My mother was on 11 pills. She had a pill to make her pee, and she had another pill to stop her from peeing. She was in anxiety. She had all kinds of pills, and which I'm trying to make this as fast as I can. I'm sorry.
Thank you, Carolyn.
Yeah, and to think. And I wish that we had the power in us to make sure that we have the best people to caring for our most beloved people, our seniors, who have lived a whole lifetime and have given to not only us, but to their communities and to the world. And it's not fair to let them be mistreated, not maybe intentionally, but without the care that should go into administration, government, and everything. And I know there are a lot of people who really do care, but sometimes hands are tied. And I
Right.
think that's where we have to get
Yeah.
some kind of a coalition to do that.
Thank you. And on that note, I think since we are over time, I'm
Sorry.
going to
I
conclude.
got, Jack, I just want to
ahead.
point out that in the chat box is how to get a hold of the SMART guide for how to choose a nursing home. And you can go to that website, you can download it, and then you can freely get it published in your community and distribute it. There's no copyright on it.
So thank you. I mean, this is an eye-opening and heartfelt and human-based discussion that we've been having. And I just want to say thank you for very passionate and loving comments from everyone, including, of course, all the panelists and all of the chats and everything else that's been going on. We have a lot of work to do. And as we are all here, we are all honoring nursing home lives. Evie, would you please be so kind as to make a closing comment?
Yes, can you hear me or am I
Yes.
muted?
Yes.
Not now.
Now I'm unmuted. Yeah, so everything that's been talked about is really why our coalition has formed. Again, I think I mentioned that some of us have been doing this work for 40, 50 years to create change. And I certainly want to urge you to look at the Eden Alternative website and the Pioneer Network website so that you can see that what was just expressed about people sitting in wheelchairs and drugs. I mean, reforms have been made in this area, and unfortunately not enough nursing homes. And so our coalition has come together to raise the awareness as well and to educate people as to what can be, that there can be quality of life, there can be joy walking into a nursing home. It can be a different world. So I urge you to look at these websites. I urge you to read the call to action paper. I urge you to become involved with us so that we can make this a big national movement for social change.
Thank you.
Thank you.
All right, I'm going to sign off. Thank you, everyone.
Thank you.
Thank
Thank you, Jack.